Hi, Dr. Duke again. We're back with G. I'm going to now take and pay attention to her hamstring. She has a mid-belly strain, which if we don't treat will turn into a high hamstring tendinopathy. And that plagues a lot of runners and puts an end to a lot of careers and fitness trainers as well. She had, just a reminder, she had a lot of issues with her foot, which we first mobilized, manipulated using active release and Graston techniques. Now I'm going to start with Graston, and I'm going to flex her foot, and we're just going to slowly scan. And the reason I'm scanning from the calf up is because you have to make sure you cross that joint of the knee, otherwise you'll never get into the area that needs attention. And again, Graston increases a proliferation of blood supply that will break down scarred adhesions that have been dead for a while. And her hamstring is about how old, G? Say it. Come on, you could talk. It's a few months already, maybe. So we're trying to break down some of that scarring in there with the Graston. Now, bruising sometimes takes place, but it's not a prerequisite. And as you can tell, nothing is getting bruised, but everything's getting nice and pink in this area. We're going to put an end to this, even though I would generally continue with Graston for a lot longer. Now I'm just going to use a little active release, and I'm going to go down her Achilles tendon on the inner part where the tib posterior is. And then, oh, I feel the tib posterior right through the gastroc. You have to remember, gastroc, soleus, then you have the posterior compartment. You have the tibialis posterior, and you have the flexor hallucis longus. And I want to get right into the pes anserine now, which is, you know, the semimembranosus and the innermost part of the hamstrings. And all the way down, all the way down, all the way down. Ooh, I feel the tension of that hamstring. And we're going to get into the mid-belly of the hamstring, all the way down. Now tighten your quad. Good, so she creates a little extension. As a matter of fact, what we're going to do, bend your leg, put it down. Good, bend your leg, and drop it, and lock it. Good job. And bend it again, drop it, and lock it. And then I get pretty high up. Then I'm going to come down, fibular head, drop it down, so we get the hamstring as it attaches into the fibula. And we're going to go right on the vastus lateralis distal IT band, where the IT band glides with the hamstring. Gee, are you shaking or are you laughing? I can't tell the difference anymore. Drop it all the way down, lock it straight, lock your knee. Come on, lock it straight. Thank you. Now we're going to use the rope, and we're going to have her actively assist as I strip up the hamstring a little bit higher. All right, G, pull it up towards you as much as you can go. Good. Is that it? Come on. Bend your knee now so we create a little bit of mobility. And bring it back all the way to me. And do it again. Angle it towards the floor a little bit. There we go. Bend your knee now a little. Perfect. Bring it back. Now I'm going to get the dorsal sacral fascia, which runs right down the sacrum. And bring your leg all the way up again. It's a very common area that is overlooked by many practitioners. And if you don't release the tension from the fascia that connects the hamstring to the lower back, G will eventually end up with low back discomfort. Keep going. Keep going. One more tech. Keep going, keep going, keep going. Now, you're going to bend your knee and drop it down. And I'm just going to work into the piriformis. Bend it up. Drop it down, G. Drop it down. Keep breathing. Bring it back. One more. Bring it up, bring it up. Drop it down, drop it down. Good. Let's pause. Now I'm going to do a pelvic alignment for G, because I noticed that she has a functional shortening of her right leg. So I want you to lie on your side, face this direction. And again, just remember, we're treating the hamstring. If you don't do an alignment of the wheels, it's just gonna wear out again. So we're just gonna gently have you hold on. Give a little arch to your back. Now relax your back. Take a breath. Deep breath, blow it out. Perfect. Line your back for me. Oh, functional perfection. That's how you treat a hamstring.